Hey folks, I'm Dr. Scott Bulger here from Core Rehab. I wanted to talk to you today about what lymphedema is. Previously I did a video on stretching for lymphedema, but this is going back a step to talk about what lymphedema is, how we can treat it. So I wanted to create this video to address concerns that women may have regarding breast cancer and lymphedema, even though lymphedema can encompass a variety of conditions in the legs, abdomen, neck, in different areas, but with a specific awareness to breast cancer. There's a lot of women that have a lot of questions when they first hear about it, and they're nervous and scared. So I just want to go over those concerns and help answer most of your questions. So I want to go over the physiology and anatomy of the lymphatic system and its properties. The arteries push blood into the outlying cells, which then use the blood and give off waste products, which the veins then reabsorb and then push it back to the heart. This represents 80 to 90% of that total fluid volume. The remaining 10 to 20%, comprised of proteins and other larger molecules, are taken into that lymphatic system and then also put back into the heart. When the lymphatic system is compromised, such as a lymph node being removed and/or radiation being applied to those nodes, the nodes aren't as effective and they can't uptake all of the proteins. Therefore, some of those proteins stay in that interstitial space, which is the space between the cells, at the origination point, and protein draws water to that area. Therefore, the limb starts to swell. I've had a few patients ask me if they should start drinking less water or eat less protein, but that's not the case in this situation. The protein lies in the interstitial spaces that can't be reabsorbed into the venous system, and therefore is handled more through lymphedema pump management, manual lymph drainage, compression garments, and things like that that a physical therapist can help you with. So I'd like to cover the stages of lymphedema. If you've even had one lymph node removed, then you're already at stage 0. You may not notice any symptoms of swelling or fullness, but this can progress to stage 1 or 2 or even 3. Moving on to stage 1, you'll start to see the actual signs of swelling or have a feeling of fullness in the arm. During the day, the arm can swell, but by nighttime, or if you're elevating the arm throughout the day, the swelling will resolve. You might even be able to push in with your thumb and see a small divot or a pit. That's called pitting edema. However, this is a reversible process. No permanent damage has been done to the lymphatic system at this time. Moving on to stage 2, we'll find these are more irreversible changes. We're getting more hardening, more fibrotic tissue, more of an inflammatory type process, and there is no pitting edema at this stage, as you can press and you won't see a divot because of those fibrotic changes. Going on to stage 3, actually for breast cancer, it's quite rare. You'll see a misshapen hand or limb, but again, in breast cancer, we usually don't see that into stage 3. So I've had a few patients ask me if they can walk around with their arm raised all day, which sounds rather tiring, or whether they can just squeeze the fluid out and it won't come back, or have a physician drain the fluid. Well, unfortunately, the proteins don't go anywhere, so they still pull water back right away, even if the fluid has been moved out. So this is where I want to talk about the shorter term management of it with bandaging, and then the longer term wearing compression garments and possibly compression pumps to manage this. So some people may require compression bandaging prior to finding a sleeve that fits them. So if you'll see here, this is a short stretch bandage. Does not move that far. Provides compression to keep the swelling down and to help it reduce. Having a $2 ACE bandage at home similar to this, if you notice how long that stretches, these are not good for lymphedema. So even though they are more cost effective, they're not effective in managing lymphedema. Once you've been bandaged for up to a course of 2 to 4 weeks, then we go into a more longer term solution. You'll see these sleeves here. They come in a variety of different colors, shapes, and compression types. Here's a standard sleeve and also a gauntlet, which is fingerless. But then if your fingers are swelling, then we have a different sleeve here, or different glove that can help with finger swelling. Some people in unique cases might require custom measurements. So custom measurements are taken in order to find a sleeve that best fits them. Now, we don't have people wear these sleeves at night, so if your arm swells at night, then we've got awesome sleeve like this that can help move the fluid up. During the nighttime, you'll see the different chambers here that help promote that. So if you're one of the lucky ones, you get to have this awesome sleeve. So Ellie here is wearing the Tactile Medical FlexiTouch Plus pump sleeve. The device is moving air into various chambers, moving the lymphatic fluid up the arm and into the chest area. Basically, it's similar to what physical therapists do in the clinic when they're doing manual lymphatic drainage. It's just that now you can do this at home. These pumps are used for more longer-term maintenance, whereas the manual lymphatic drainage we do here in the clinic is a short-term maintenance. A lot of people will use these at home at night, and they say they're very comfortable using before you go to bed or watching TV or reading, and it's gotten good feedback from patients that they enjoy it.